Okay. Okay. Well, thank you for the option to speak with all of you. It's my pleasure. I'm Dr. Keith Jantz. I'm a retired internist. I practice internal medicine here in Kansas City for about 40 years, and now I belong to the Physicians Retirement Group. We are a speakers bureau connected with the Kansas City Metropolitan Medical Society, and we're happy to speak with you. And We'll be speaking today about COVID, and this is a controversial topic that, of course, changes on an almost weekly basis. So some of what I'm going to be talking about today might not be true a couple of weeks from now. And also, I will point out to you this disclaimer that what you're going to hear today is pretty much my own opinion and my own take on this disease. It's not necessarily the official record or stance of the Kansas City Medical Society or any specific body like that. So if we're going to talk about COVID-19, I think the first thing we need to do is get a little refresher about what it's all about. COVID-19 is a coronavirus, and there are only a few coronaviruses out there. The most common one, however, is the common cold, which is also a coronavirus, and I think we all have experienced that at some point or another. The difference between that and COVID is COVID was much more dangerous and caused much more severe disease than the common cold did. The common cold, of course, very contagious, like COVID, but fortunately did not cause any serious disease. Another common coronavirus that you don't hear much about is MERS, the Middle Eastern Respiratory virus. And this virus was particularly deadly, and the fatality rate was close to 30% in people who contracted this virus. Fortunately, it was not very contagious, and so it never spread out of the Middle East. And the animal reservoir for that virus is the camel, and since there aren't camels all over the world, we didn't run into that, so we didn't hear much about that. So the big problem with coronavirus is they tend to mutate, and mutations are frequent. The public and the press have labeled these as variants. I don't know why, because they're really mutations. And so this really presents a problem in trying to manage this disease in the pandemic because the mutations are so frequent. And unfortunately, that makes it almost impossible to come up with a vaccine that will stop this pandemic. In fact, it got to the point where we concluded that the vaccines would not stop the pandemic. They would just provide some safety for people who receive the vaccines. But as we all know, the pandemic went on and continued and is sort of in a fizzling out phase right now. It is a zoonotic type of virus, comes from bats. This is not unusual. There are a number of infectious diseases that humans have encountered in the past that have animal reservoirs, so it's not unique that way. We in medicine are certainly familiar with other diseases that come from animals and are involved with animals, so that part is not new. And the other difficult thing about the COVID is the variability of its nature when it infects people. Some people are totally asymptomatic and can carry the COVID vaccine virus and then spread it to other people. As early as 2021, the health department identified about 1/3 of people who contracted COVID, and that was even back in the earlier strains, the Delta and Omicron strains. About 1/3 of people who contracted it were totally asymptomatic, had no symptoms, had no idea they were even infected, shed the virus and passed it on to other people without even knowing it. So once again, this makes it extremely difficult to control a pandemic when you have people who have no symptoms like that. Now, when this virus infects people, it's usually the little spike proteins that you see sticking out on the diagrams of the virus. These act like a key, and they attach to the surface of a cell, usually a lung cell if it's inhaled. And then that opens the cell wall and allows the nucleic acid material in the virus to enter into the cell, damage the cell, or alter the cell. And this is how it all gets started. Usually in the first 5 to 7 days of infection, a person has typical viral symptoms, fever, chills, headache, runny nose, dry cough, muscle aches, things like that. And then usually a person's immune system will take over and take control of the virus so that it doesn't spread. However, in an unfortunate group of people, they're immunocompromised and for one reason or another, and the virus enters into the body and enters into a second Weeks phase, which is more of an autoimmune type phase where the body reacts to the virus and generates antibodies, which also attack some of its own tissue. And in the process of this, the byproducts of the virus tend to cause severe lung damage, sometimes kidney damage, blood clots, and other problems, which cause people to end up being in the hospital and requiring a lot of aggressive therapy for the problem. So that presents a real issue for physicians because somebody comes in with typical symptoms and particularly this time of year, it could be influenza, it could be RSV or respiratory syncytial virus, or it could be COVID. The symptoms are very similar, are almost identical, and the only way that you can differentiate between one of these three would be to do some testing, and that's usually done either in the home with a home test or can be done in a hospital or a physician's office with a PCR test, which is more accurate. So the real question is, what should we do at this point in time? Where is COVID going from here? Well, it was severe for 2 years and is still hanging around, and that's typical of pandemics. People always thought that the swine flu of 1918 and 19 was a 2-year phenomenon. Actually, it was a 4-year phenomenon, and swine flu deaths went on for 2 years after the year 1919. So that's still a possibility, and we're not surprised that we're continuing to see COVID infections and we're continuing to see COVID deaths even now. The difference now is that most of the virulent strains are not present anymore, and because of mutations, these newer strains tend to be less virulent and cause less severe disease. You will recall when COVID first came out, the variants were called alpha and beta, and they utilized the Greek alphabet. And of course, the Delta was fairly severe. The Omicron one was also fairly severe. But there are a number of other variants in between that the public health was concerned about that never materialized, Lambda being one of them. We were warned that this was going to be terrible, and it never happened because it turned out that the Lambda strain was rather mild and didn't cause any severe disease. Well, now there are so many variants or mutations that they've run out of the Greek alphabet, and the virologists are naming these variants with different names. You've got BA and BA1, and BA1.1, BA2.1, and then EG, and then XB and JN1. So they're putting all sorts of different labels, and each one of these is a different virus with different characteristics. And unfortunately, with each one, the vaccines are not necessarily particularly effective. So what should we do at this point? Well, COVID's here to stay. I think it's probably going to show up in the fall, just like influenza does. It's probably going to cause some deaths. Influenza in our country causes about 20,000 to 30,000 people to die every year. Most of these people are elderly, immunocompromised, or in a nursing home, something like that. And so COVID going forward is probably going to be a problem for people in this situation. But for people who are relatively healthy and younger, what we're probably going to see is the same thing we see with influenza is you get the flu, you stay at home for 3 or 4 days with fever, chills, makes you feel really bad, but recovery is usually complete. And because of that, it's going to cause a lot fewer deaths and a lot less morbidity and mortality. Eventually, probably everyone is going to get COVID, though, one way or another. It's going to be prevalent enough in our community, and because there are so many people walking around who are without symptoms at all, totally asymptomatic, there's going to be a tendency to spread that. Unfortunately, that's one of the other aspects of viruses. People who become infected with a virus will tend to shed it maybe as much as a day before they even have symptoms, and sometimes for as many as several days after the symptoms have resolved. So even when a person quarantines at home for 3 to 5 days because they're sick and then returns out in the public or the workplace, um, after their symptoms have resolved, they may still be shedding the virus. And this has been a problem for the home testing kits, because the home testing kits sometimes will test positive even if the virus is not present, or if some dead viral remnants are still present that a person is expelling either in their breath. So some people who are not shedding the virus anymore still think they are because they're testing positive. And because of this, the CDC, I think, just recently has eliminated their 5-day quarantine recommendation, because what they found was that people shedded the virus anywhere from 5 to 20 days after an infectious event began, making it pretty difficult to determine when it's actually safe for someone to leave their home and go out in public. So what should people do? Well, at this point in time, I think it's really important for the public to determine what their own personal individual risk is. And we separate people into two risk categories for COVID infections: high risk and low risk. The high risk people in general are people who are over the age of 65, but also usually have some other chronic disease or ailment that contributes to their impaired immune status. This certainly applies to people who have cancer or are being treated for cancer, whether they're being treated with radiation or chemotherapy or both. They would have some impaired immune status. Also, people with chronic diseases like congestive heart failure, chronic kidney failure, whether that person's on dialysis or not, even if they're not on dialysis, but they're being followed by a physician and being told they have chronic kidney failure. Also, COPD or emphysema. Anyone with any kind of respiratory failure, people who smoke for years and have permanent lung damage, people who are on oxygen on a regular basis because their lungs aren't functioning properly. All of these people are at high risk. And the reason that it's a risk is a problem is if they develop COVID and it turns into pneumonia, these are the people who end up having to be hospitalized. They have an increased risk of ending up not only in the hospital, also in the ICU and on the ventilator. So these people are certainly at some increased risk. So who are the low risk individuals? Well, that's pretty much everybody who's not in the category I just mentioned. So if you're under 65, relatively healthy, you don't have any chronic disease, staying pretty healthy, your risk is pretty low. The only younger people who have some risk are people who are severely obese. This is one of the unique things about COVID, is that we found that very obese people seem to have impaired immunity, at least to COVID, and seem to be susceptible to severe disease requiring hospitalizations, ending up in the ICU and ending up dying. Early on in the COVID pandemic, we saw people mentioned or shown on the media, on TV, who died from COVID, but a significant number of them at a younger age were seriously overweight or obese. So obesity is one risk factor that would make you more susceptible to COVID. But if you're relatively young, I mean, if you're in your 20s, 30s, or 40s and you're healthy and don't have any chronic diseases, COVID is probably not going to be a serious infection for you. It's probably going to act like influenza in that you will develop an infection. You'll feel sick for a few days with a headache, fever, cough, runny nose, sore throat, and really feel terrible for a few days. But then it would go away. So I think it's really important to separate out whether you're at high risk or not, because that determines how you're going to approach and manage this problem going forward. So there are some general health techniques that everyone should follow, and these have to do primarily with simple hand washing. This was something that was emphasized early on by the health department, and then they kind of dropped it off. Mainly because it was determined that the main form of transmission of COVID was by aerosol through the air, and it wasn't necessarily by contact. I know early on we were, wiping off all our groceries when we brought them home from the grocery store, and later on it was determined that that was not so much of a problem.